very rigid tape. It's not going to have any give to it. This is just to protect the skin. Okay, so what we're going to do is we're going to put a layer of this down. Around the, you okay if we tape this for you? Okay. Layer of this down. 1 or 2 straps of this around there to hold that thing in place. So right above, we're going to measure right above the malleoli. Scissors aren't so good. Towards the end of this roll of tape, so it's going to start curving on me pretty quick. Okay, what I will always do, I will always start going from medial to lateral on the flat part of the tibia. Okay, I don't need any tension on this. This is not doing any corrective work. This is just here to protect the skin. So what I want to try and avoid is any wrinkles, any creases, any of that sort of stuff on this. Okay, so we're done there. That's the easy part. Now, get our tape out here. You want to see a little trick. Make sure it's long enough. Tape's getting old. In my backpack for a couple of years now. Okay, so same thing, I'm starting right there. Now what I need to do is I need to get around the fibula. Okay, so I can don't need to lay a ton of tension on it yet. But there's 2 things that I have to consider. Number 1, I have to make sure that there's good adequate compression between the tibia and the fibula. So I'm going to squeeze here to hold those together. Number 2, I want to make sure I don't tourniquet her foot. All right, cut off the circulation. So to keep the tarsal tunnel open, I'm going to have her splay her toes open, just like that. Is that the best you can do? Yes. Okay. All right. We're going to check you for neurological problems after this. All right, so I'm going to squeeze. She's going to splay. Tension. Done.
Right now you have her in some plantar flexion, so
Doesn't matter. No. Because the patent mortise is going to have enough room for the talus anyway, right? So I want to be able to make sure I can compress this without it being pushed open. Now, if I had her way up here, that'd be a different story, right? Because now maybe I might be pushing it open. So this is just a rest position. Okay, now I might, depending on the amount of instability, right? If it's really super lax, or if I'm just dealing with somebody that has, you know, real big wide leg, something like that, I might put another strap of the leukotape on here. I've done this where I've actually gone down a little further so that I'm actually over about half of the malleolus. Again, just for leverage sake, to keep that compressed. But I've had perfect success with this above there. Benefit to having it above there is it's not going to get in the way of her ankle motion. Right? If I come down too low, now she's going to be bunching all this skin up against that tape, and that's not going to be very pleasant. Because here's the big issue. In a more unstable mortise, hers has a little laxity to it, but I wouldn't call it unstable. You have to keep this tape on here every time you put your body weight down on that foot for about 6 to 8 weeks. Okay, that's the amount of time we typically anticipate the production of new collagen to take. Now, that time frame can be skewed one way or the other based on the person's overall health status. So in her case, because we're dealing with somebody that didn't have a ton of instability to begin with, relatively speaking, it's a light laxity, mild laxity, young, healthy, I'm assuming non-smoker, no major health issues, right? Probably would start reach stress testing this at about 2, maybe 3 weeks. But if I have a 55-year-old man coming in that's a smoker, that has blood pressure issues, that has had a history of cardiovascular disease, any of those sort of things that will affect healing time, if they have varicose veins, if they have any of that sort of stuff, then the time goes from 6 to 8 weeks to 8 to 10 weeks to 10 to 12 weeks, depends on the number of comorbidities. Somebody that's diabetic, again, same sort of thing, micro blood vessels, etc. These sort of things are going to take a hit. You got to take into consideration the entire patient before you can kind of really give them a good time frame.